Okay, thank you so much for joining us today, Crystal. This is one of our Northwest Missouri AHEC's virtual career chats. We're excited to highlight a lot of the different areas in the hospital that have to do with dietary or a clinical dietitian. And we've never done that before. So we're really happy. I know students like to start out in this area, especially as an entry position, or they may be thinking long-term for that clinical dietitian role. So I will go ahead and let you introduce yourself. Students, please feel free to, if you do watch this, you can send me a message through email or through Northwest Missouri AHEC at mymlc.com and let me know if how long you watched it for, if you wrote a paper on it, anything like that, and I can add those hours to your transcript for our AHEC transcripts. So I will go ahead and I'll let Crystal introduce herself and then we'll get started with our questions.
Hi, my name is Crystal Staggs, and I'm the clinical nutrition manager at Mosaic Life Care in the acute care. So I manage both the nutrition technicians and the clinical dietitians, and I've been here for about 20 years.
Perfect. Thank you so much. Okay, so based on what you just told us, it's kind of going into the your introduction here, but what is your job description? What all do you do?
So my role is actually the manager, and so important features of my job include setting kind of the dietetic and nutritional guidelines for our patient menus, determining what is allowed on a heart healthy diet and what isn't, and then helping our nutrition technicians to assist our patients in following that. And also, as the manager for the clinical dietitians, I help oversee nutritional care policies such as, what patients are seen by a dietitian right away versus maybe a couple days into their stay. So just helping set those nutritional policies and manage in general in the department.
Perfect. Wonderful. What made you decide to go into this profession?
Well, my mom was a nurse, and so I was always exposed to the healthcare industry as a child, going to visit her. And when it came time to choose a career, I knew that nursing wasn't probably for me, but I had always worked in food service for as a teenager. And so it just seemed kind of like a natural progression.
That's great, especially to stay in healthcare. A lot of people probably don't understand that your position is also in healthcare and you do see patients. So
yes, we're very hands-on. The registered dietitians that I manage, I mean, that is their role. They see patients every day, all day. And so when we have outpatient dietitians, they visit with patients one-on-one in the clinics, and it's very patient-focused.
yeah, I like that. So you mentioned that you did have a background a little bit in this role before, maybe with working in food. So did you have any previous careers in healthcare prior to joining at Mosaic?
No, this is actually the first place I worked. Well, I take that back. I worked at AHEC during college. I guess I forgot about that. But yeah, I worked with the Women, Infants, and Children program during college. And then this was my first professional job at Mosaic, and I have just stayed here.
Yeah, worked your way up. So it worked
Yes.
out for you so far. Good, good. What soft skills would you say that you would need for this profession? Like patient interaction, communication with patients? Do you work alongside your coworkers quite a bit?
Yes, I would say communication skills are of utmost importance. A lot of times in my role, my specific role, I'm visiting patients when they're upset. So if you tell someone that really enjoys bacon that they can't have bacon, that is something that, and it's really not about the bacon, it's about control. Everybody likes to be in charge of what they eat. It's something that gives us pleasure. And so helping people to make those choices that'll benefit their health requires a lot of empathy, requires some really good listening skills. If you're in the outpatient setting and you're doing counseling, you have to, really have those listening skills and those behavioral counseling skills. And that's something I didn't realize when I was in school would be so important. And so making sure you really listen when you're in those classes that are teaching you how to, do some counseling or just some listening skills. You have to be able to do a little bit of speaking in front of people. because even though your role is not, like my role is not public education, but I get a lot of requests to speak to groups. And so as a dietitian, you're going to get requests to speak to small groups, large groups, and that may not be your role, but inevitably you'll end up in doing something like that. And then I would say just, again, it kind of goes back to that listening and meeting people where they're at. So you have to just know that everybody's at a different spot in their life, especially when they're in the hospital. And sometimes I remember when I first started, one of the people that trained me said, sometimes people just want you to touch their hand and listen to them. You're not going to be able to fix anything. And I really think that that is very important. As a dietitian, I have a slight bit more freedom in my day. I don't have to give meds right at 8 o'clock or something like that. And so sometimes I think we have the ability to just spend that extra time and make it meaningful.
Yeah, I like that how you said counseling, because I know it's your own independence to choose what you're eating for the day or to go and order your food. And so and to not, once you think about having that taken away, I'm sure that it is pretty hard, emotionally and physically on the patient. So I'm sure counseling is quite a bit of what you do.
Yes, and we even have a certain condition where people can't have like salad. And believe it or not, the minute you tell someone they can't have a salad, that's all they want. And so it's just learning how to deliver those messages with a soft touch and helping people
Yeah.
understand why.
Yeah, I like that. That's something probably a lot of students don't think of before going into this career. So I like that you touched on that. What would you say a typical day is like in your career? I know that you mentioned, working outpatient versus inpatient. Um, so in the inpatient world, what's your day like?
So the inpatient world, I'm going to tell you about the clinical dietitian's day. My role is sometimes putting out fires as a manager. But a clinical dietitian is going to come in and they are going to look at their nursing unit for the day, and they're going to look at all the patients that need a nutrition consult that day, whether it be for education, for nutrition support. Maybe they're having difficulty with their diet and they have questions, any of those types of issues. Maybe they're very underweight, signs of malnourishment. So they're going to put a list together and then they're going to spend the day visiting those patients and implementing the interventions, nutrition interventions that will benefit the patient and help them heal. So it could be oral nutritional supplements, something they'll drink, could be a change in a diet, could be nutrition support through a feeding tube. It just really depends. But that is their day, taking care of acute care patients.
Okay. Okay. And do they work with both adults and children?
Here at Mosaic, we work with mainly adults. Our pediatric unit is very small. Um, so yeah, it's mainly adults.
Okay. Okay. Interesting. What other departments do you work with, or would a clinical
Um,
dietitian?
I do want to quick mention with the outpatient dietitians, but we do
Oh,
have we have one at our diabetes center, so we do have those here in Mosaic. That would be more like teaching classes and meeting with patients one-on-one in an office to do nutrition education. So there's kind of two sides of what dietitians do at Mosaic, and that would be the other option. So but then we work with all sorts of departments, mainly nursing. We work a lot with social work, and then of course the physicians. So I would say those are the three biggest ones. We also work with our speech pathologists. So just last night I had a patient who failed their speech eval and they had to go on softer foods. And so then I needed to go in and explain to that patient, this is what you're allowed, this is for your safety, and kind of help them ease that anxiety about, not being able to choose exactly what they wanted. So we work with that department closely. Yeah.
okay. And then do you ultimately decide what the patient can and can't eat, or is that dependent on the physician that makes that order?
Well, I'm glad you asked. Dietitians are actually one of the very few ancillaries departments that can write nutrition orders independently. So we can decide. Now, we will not take a patient who is not allowed to eat and tell them they can eat, like if they have a test or something. But once the physician says they can have something to eat, it's the dietitian's job to make sure they're on the right diet. And while most disciplines in the hospital need the physician to sign off on their orders, we actually don't. Our physicians at Mosaic have said, we trust your nutritional expertise and you are able to write those diet orders independently, which is kind of a neat thing in our profession that we are able to do that.
Yeah, that's really nice. That gives you some independence, I'm sure, and makes things probably a little bit quicker. You're not waiting for that order.
Yes. And of course, we would always consult the physician if we had any question. We work very closely with them on a day-to-day basis, but it does make patient care a lot quicker sometimes. So that's good.
Nice. I like that. Okay, so to get to where you're at or to get to a clinical dietitian, what education is needed now? I think it changed recently. Am I right?
Yeah, starting in January 2024, it requires a master's degree. So most programs are set up so that you can, well, most programs will be, they're transitioning to programs where you can do all the undergrad and the master's at one um, university.
Yeah.
And then you have clinical experiences during that master's program. So the first 4 years would be your typical undergrad. And then once you got your undergrad degree, maybe you get a little faster because you did some college courses in high school. But once you're in that master's level, you're going to be a mixture of classroom and then clinical rotations. So like right now, we have a student from Northwest Missouri State that is working with our clinical dietitians for 8 weeks. So she comes in and she does their job and they teach her while she does it.
Okay.
Yeah.
Yeah, so kind of
And
like
then
student teaching.
you do have to take boards or that's one of the ways. It's similar to boards for a lot of different disciplines, but yeah, you have to pass the certification test at the end.
Okay, and are those certifications every so many years that you have to pass, or once you have it, you're good?
Once you pass, you're good, as long as you participate in 75 hours of continuing education every 5 years.
Okay,
And
that's
do
not too
that,
bad
and you're
then.
good.
Yeah, it's not too bad. And then are there different types or different levels of dietitians?
You can, so you have your entry level, which would be, just out of college and you passed your boards and all that. You can obtain some specialty certifications in topics such as pediatrics, cancer care, nutrition support, weight loss, and dialysis or renal care. So there's all sorts of specialty certifications you can obtain. Those aren't required for a job typical like at Mosaic, but in some of your larger hospitals, inner city type or specialty hospitals like Children's Mercy, they may require some certifications.
Okay, nice. So you can go ahead and start, maybe get a feel for what department or area you like best, what specialty, and then if needed, you can specialize in those.
That's always, I would always say start first and then figure out where you want to specialize because I don't think you know until you get into the profession.
So true, so true. What would you say to someone interested in this career, or is there anything else you'd like to add? If there's a high school student thinking, maybe I want to go into, dietary, or I want to become a clinical dietitian, what would you say to them?
Yeah. Never say no. That's always my advice to students because you don't know what experience you'll have that you'll enjoy or that you'll learn from. And so nutrition, if you like food, if you like people, nutrition is a very interesting career and there are so many options as far as places you can work. But no matter what option you're in, you'll be dealing with food and or people. So you really want to enjoy those aspects and wanting to help people, wanting to see them get better. We get to do that a lot in our profession. So if you enjoy that, it's a good job. It's very flexible usually, which is nice. And there's just a ton of variety. So if you think those things appeal to you, I would encourage you to consider a career in dietetics.
I love that. And I know that we work closely with you in scheduling job shadows. So if even high school students are interested or kind of getting their feet wet, I know that you would welcome them
Yeah.
to shadow, I'm sure. So
Yes, we always are accepting shadows, and I always have to get a plug in if we have any um, high school students that are really interested in nutrition. We are hiring to work in our nutrition services department. And actually, I love to hire, pre-therapy or nursing students or whoever needs to be exposed to the hospital. It's a great job to get to see all the nursing units and see patients and understand what you're getting into. So always have to mention that too.
Yeah, for sure. I know a lot of students are interested in beginning at Mosaic when I go and talk to them and, at their high schools. So are they able to start before they graduate, or do they have to have been a high school graduate?
Think we take a rehire at 16 now for our department. Just
Okay,
for
wonderful.
nutrition services. I'm only speaking for nutrition services. So yeah, just kind of depends on scheduling usually, but yeah, we hire at 16 and of course anybody that's interested in the medical profession, we love to support that and get them exposed to it. So we have a lot of people that come and work for us and then move on to CNA or PTA or just all sorts of places. So
Yeah, it's a great way, just to get your foot in the door, I would think, especially at 16. I would have loved to have been able to do that then, so that's great. They changed the age. So
yeah, I think they just changed that. So gosh, I hope I'm not speaking wrong, but I'm pretty sure. Yeah.
that's okay. We'll confirm. It's okay. All
Yeah.
right.
Double check that.
Yeah. Perfect. Well, thank you so much for joining us. If a student has any questions, then I will more than likely reach out to you and see if maybe we can make a connection there with that student and you, Crystal. So we appreciate you taking your time out of your very busy day and hope you have a good rest of the week.
Thank you, Taylor. Have a good one.
Thanks, you too. Bye.
Bye.